Hi, everyone. This is Kathleen Ennis-Durstine, Manager of Chaplaincy Services at Children's National Hospital. One of the things that is important to me about my work as a chaplain at Children's or in any organization is the charge I feel chaplains have for the well-being of the organization. So emotional, spiritual, religious, psychosocial. And part of that well-being is lifting up the programs that are making a difference in the lives of our patients and families. And because of that, we really want to introduce to you today a very special program and its very special leader. This is Brooke Goodwin. Brooke, hi.
Hello.
Would you introduce yourself to all of our staff and folk and tell us a little bit about this new program that you're working on right now?
Yes. So I'm Brooke. I've been here at Children's for about 16 years now.
I can't believe it. Wow.
Working across social work and the ombudsman team. So I've worked in those two spaces. But recently back to social work and working in the outpatient setting with a program called Community Core that's born out of the Clark Foundation and their parent-child health initiative that started in July of 2020.
Okay.
And involves 3 hospitals in DC and some very notable community organizations, and really trying to lift up our patients and families in our lower income areas in the city, and really helping to get them those wraparound supports they need. We acknowledge that a lot of Ward 7 and 8 don't have as many hospitals in those areas or healthcare opportunities as do other areas of the city. And so just really trying to wrap around those families. And we're looking at a population of ages 0 to 3 specifically, and looking at adverse social determinants of health for them.
So define adverse determinants of health for us.
So they're really insecurities that families have. So we can talk about food insecurities, housing insecurities, housing environment insecurities, transportation, childcare, employment, education, safety, literacy, kind of run the gamut.
That's a long list.
Yeah.
And how do you assess families? How do you meet them? How do you get involved?
So our program is in 4 of our 5 Goldberg primary care centers.
Okay.
And so we have family services associates who are there who meet these families at the newborn visits, introduce the program, also ask them about resources that they may need, such as WIC, diapers, ensure that they've got the insurance application going, information about how to obtain the birth certificate, and then just let them know that they'll be getting screens at various appointments as their child ages up through age 3.
Okay.
And if there are needs, to please let us know, and we will follow up with them and try to get them supported by an organization in the community, or give them information so that they can get the services that they need.
So you need to collect a lot of information on what available resources are in different neighborhoods.
Yes.
Is that going easily, or is that a struggle sometimes?
It's, I have to say, Family Services has always had family services associates in them, more so in the inpatient setting.
Right.
And they have a wealth of resources. Probably about 4 years ago, we had an FSA start in one of the Goldberg outpatient centers. And so that FSA really has put together a wealth of information across DC. So we're coming in and really focusing on those specific areas where the centers are, and really trying to pull together, real current resources, and really knowing what they're doing as COVID has changed a lot of things, and organizations have added things and limited other things to really meet the needs of the patients.
What's been most exciting to you so far about working with Community Core?
I think it's really honing in on those needs that that our families need, that really cause challenges for them to be able to get the healthcare that their children need. I think prior to the pandemic, people were struggling, but after the pandemic, the struggle is real. Virtual school caused a lot of people to have to stop working.
Sure.
And you know, they lost their childcare, they lost their jobs, and trying to come back from that is just really is challenging. Everybody needs childcare. Transportation, you know, is also, you know, have been a challenge, and people just don't have the financial savings or, you know, opportunities, not having jobs now, that it's really a struggle for our families.
I can only imagine. I mean, it's been a struggle for everyone.
Yeah.
And so those without access to good resources are doubly struggling.
Yeah.
And it sounds like it's more than just access to physical things, mental health services, other emotional support.
Yeah. And there's the stigma around that, you know, especially for, you know, our Black and brown families. And, you know, there's just that generational stigma of, you know, of mental health, and, you know, really being open to seeking those services. And so I think, you know, adding that on top of all of the challenges and insecurities that they're having now, that's kind of being dumped towards the bottom of the pile. You know, people are choosing food over even getting their kids in for immunizations because they know they can catch them up, but they want to be able to feed their family.
Of course.
And so that's where we're starting, or housing, or not having, you know, adequate housing, or having, you know, infestations in their home, or a lot of our asthmatic, you know, kids having mold and, you know, and other challenges. That's really where the focus is. So things filter down.
So I know that these kinds of concerns have really been a passion of yours for a long time. Did you come to it with a lot of excitement? Did they have to twist your arm?
So no, I mean, I think in social work, I've kind of worked across everywhere. I've been inpatient, I've been emergency room. Outpatient was an area that I hadn't really touched upon. And then after becoming a mother, and using, you know, my child goes to one of our primary care centers, you know, and really seeing firsthand what those needs are, and really, you know, it was a no-brainer. You know, I want to be there to help these families to locate the supports that they need, navigate these systems that generationally have been a challenge, and you know, also, you know, working in the ED, we have a lot of infant mortality, and just really wanting to make sure they have a pack and play, and are practicing safe sleep, so that, you know, they don't have to go through having to lose a child.
Absolutely. Do you have a favorite story so far from what Community Corps has been able to do?
Do I have a favorite story? I mean, I think just the FSAs have really connected, you know, with some families. I have one FSA who has really been able to connect with this mom who just didn't want to open up, didn't want to, you know, really get into what, you know, the needs were.
Right.
But through, you know, calling and checking in and asking, you know, has this resource worked? You know, and then understanding what that is, and then she, you know, then 3 more come about, and so, all right, let's tackle those. Let's try to figure out those. And she's really, just really opened up, and we've really been able to help guide her to the resources that she needs. And now she's actually kind of getting back on her feet and trying to look for a job.
Wonderful.
Because she's been able to tackle the other things that are more important to her, for her children.
And all of those things, being able to provide those things, gives you a different sense of self-esteem and sense of control over your own future, don't they? Yeah.
Yeah.
No, that's wonderful.
Yeah.
What's the message that we need to get out to our in-house community about Community Corps? So to our staff who are working on site here at the Sheikh Zayed campus, what do you want them to know? What do you want them to take back to their neighborhoods about this? And how are there ways they can get involved that would be helpful?
I think it's really just, and this is for everybody, to understand that everybody's struggling in some form or fashion. They were struggling before COVID. It's a different kind of struggle, you know, now. And I think our team is really looking into churches and places of worship in the community now, and
okay.
really looking to understand what resources they're providing. On my journey to work every day, I pass several churches where it's free produce on Tuesdays.
Yeah.
And it's, they have, childcare options or clothing options. And so we said, we really need to look at the churches in the neighborhoods that also can alleviate some transportation challenges.
Maybe.
And it could just, any feelings of shame or, feelings of not wanting to admit that they've got an issue, don't want to walk into, a community organization that they don't know. Maybe the neighborhood church, their neighbor they know goes to the church down the street, and it's more comfortable.
Okay.
And so we're really looking at churches and trying to figure out what resources they have to be able to offer those as well.
Okay. So if someone is going to a church, a mosque, or a synagogue who has a program,
Yes.
Maybe what they need to do is send you an email
Yeah.
when they get here to work.
Yes,
And
shoot
say,
me an
have
email.
You thought about this one?
Yeah, let us know what's out there.
Okay.
If your church or your place of worship is doing, great things for the community, let me know. We can add it to our list. And I'm
Okay.
sure that somebody can benefit from it in some way.
Okay. Well, I think it's really an exciting program, and I love the focus on making sure that families with newborns, that's a great place to start,
Yeah.
are beginning to put all the right services in place, because as their family grows, hopefully then they'll have those ongoing resources
Yes.
and be able to continue to support their families well. But I hope you know that the chaplains are very supportive of you in this work in whatever way we can be, and we just want to lift it up. We want to say thank you for having that passion and compassion to care for these families.
Thank you.
You're welcome. Thanks again, Brooke, and thank you very much for taking a look at us today.